Warm welcome to you from Geneva, Switzerland. This is Rida Sadki from the Geneva Learning Foundation. We're running down the clock until Teach to Reach Connect 4, and we realized this morning that we have so much to share, so many opportunities, that we would hold a special information session just to tell you what is coming up Friday and how to get the most out of it. So we'll see you in 55 seconds. All right, a warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. Very pleased to be here. Why are we doing this information session? So on Friday, we are holding Teach to Reach Connect 4. This is a massive event, and I can tell you, we just checked this morning, over 5,000 immunization professionals have registered for this event on Friday. We'll see how many actually make it despite connectivity issues. But we realized actually that there's so many opportunities on Friday, opportunities to benefit you and your work, that we wanted to hold this special information session with Charlotte Mbu, who is having connectivity issues, as we all do at one time or another. So I'm going to kick off without her, but hoping very much that she joins. So this is the main page for Teach to Reach Connect 4. So if you haven't been there yet, you can see the address. It's learning.foundation/teach to reach. And what is it? It's really a unique occasion. So you may have attended webinars in which someone presents technical information through slides, or maybe you have group discussions in a Zoom room. This is very different. This is all about meeting, networking, and learning with fellow immunization professionals from all over the world, as you can see here. This is the 4th edition that I'll tell you how, and it's happening in 3 days, 21 hours, 28 minutes, 35 seconds as we are recording this this live stream. If you're watching the recording, check the dates. This happens every 3 months. All you need to do to request your invitation is click here, put in your name, your email, and then request the invitation. Now, let me go to Joyce Moriti. Joyce Moriti, why are you looking forward to Teach to Reach Connect? What do you think you will gain from it on Friday?
Thank you so much, Reda, for this opportunity. I'm Joyce Moridi, joining from Maryland. There is so much to learn from Teach to Reach, listening to other professionals about what they are doing in immunization. You find that there's always something to learn from other people, from different parts of the world, wherever anyone is connecting from. And just by yourself, you cannot know everything. There could be something that you're trying to do and you're having challenges, and you can learn from somebody else who has succeeded in that very same idea elsewhere. Thank you very much. So this is what I'm looking forward to gaining from the Teach to Reach on the 10th.
Wonderful. Thank you. Thank you so much, Joyce. That's very well said, I must say. So it's a unique experience. I'm going to show you here in just a couple of minutes. It's actually a tutorial, a demo that you'll see, you'll find on the Teach to Reach webpage. So you can see here, actually just connecting. Once you're in the Teach to Reach Connect website, we use something called Hop-In. You connect up your webcam if you can afford it, or just your microphone otherwise. And you click on a button, and you can see here, I'm actually just connecting right now with somebody else. This is from the previous Teach to Reach Connect, so don't get confused, it's not happening now. And here is Najib Habib Hassan, and he appears on the screen, and I can talk to him, and we give you some discussion questions and some specific topics, but you are free to just get to know Najib or anybody else. And then you can see that if both parties agree, you can actually share your contact details. You can also extend the session. Initially, it's 5 minutes for each session, and that's basically how it works. Now, step one, of course, is to request your invitation. So you need to find the Geneva Learning Foundation website and then request your invitation. Now, once you're in, once you've requested your invitation, you'll receive the link to go to this website. This is where the conference is, the networking event is actually going to happen. So here is a very important step. You need to do a couple of extra steps to get what we call your ticket. Now that just means your login, your ability to connect to this website. So how do you actually do that? So let me show you here. Let me get myself out of the way. And here are the tickets, all right? So you can see they're all free for country-based immunization staff. If you only speak English, you click here. If you're bilingual, you click here, all right? Once you've selected the right ticket, don't make a mistake, because otherwise you might end up networking with French-speaking folks. If you don't speak French, it's not going to be very much fun. Now, if you're global staff, we ask for a small cost contribution to help keep doing this event, and we appreciate global staff that do contribute. Now, once you've selected your ticket, you go to checkout, and this is where you're going to need to log in. So how do you do that? The easiest way, now you can sign up with email. It's what we used to do, but I don't actually recommend that. I recommend if you have a Facebook account or a Google account or a LinkedIn account, just use any of those, and that'll log you in right away. You don't have to do anything else. Watch, I'm just going to click on Google, and you'll see it'll ask me to use my Google account, or in this case, I have many accounts, so this is the one I'm using here, and boom, I'm in. That's it. That's all I need to do to get into Teach to Reach Connect. So that's how simple it is. I'm now going to go to let's have a look. We've got Lara Adeyemi. Lara, you haven't told us you're watching from YouTube. A warm welcome to you. Please tell us where you're connecting from. And then, of course, we have Amel El-Taher watching from the Saudi Arabia, and Noor Ahmed from Somalia, who says, nice being here. We hope, of course, we're waiting for you on Friday. Many of you are going to are connecting right now for this information briefing, and you're also getting ready for the big event on Friday. Now, why are we doing this information session? Well, let me show you. It's very simple. Let me just go back to the sign up. Yeah, and here. So let's go to the schedule. And so when you go down to the schedule, let me go here. So this is from the website where we will be running the actual event. And you can see, don't get confused, okay? The first part, it's all French. Don't get scared. You can actually go to the little filter here and click on English. And now you only see the English language sessions. Of course, if you're bilingual, like probably Naila Abu Dugan from Lebanon, who says hello. All right, hello back. You can attend both sessions. The French language sessions are in the morning. This is Western European time, or Geneva, Switzerland time, I should say. And then the English sessions are in the afternoon for us. If you're in Asia, we realize that it can be very late in the evening. So what are we actually going to do during this Teach to Reach Connect? So first of all, you can see here from 2 to 2:30 now. When you go to the Teach to Reach Connect site, you'll see the time in your time zone if your PC is configured properly. So make sure you double check that. You can actually hear for the events the specific items that you're interested in. You can download if you use Google Calendar or Outlook, or if you're on an Apple device, you can just download the calendar invite and then add it to your calendar, so you make sure you don't miss it. So first of all is a tutorial to explain how the networking is actually going to work. Second is the opening ceremony. So this will be a formal moment, but this will actually give you an overview of what's going to happen throughout the event. And then we'll have the global and regional and country partners present who will also say a word. And this will hopefully give you a sense of the meaning of the event. It's also the one time when we will all be connected as a global community. So I really encourage you to join the opening ceremony. Make sure you do not miss that. Next, we have, all right, I see Charlotte is back. So Charlotte, let me check in on you. What is happening with your connectivity? Tell us. And I'm sure on Friday, many of you will have problems too.
And hi, everyone. It's a pleasure to be here. So there is an internet blackout in my town. So, but I kind of like using alternative and other backdoor means that I have to access the internet, but it's not very stable. But I've been able to join, and I'm so glad that that I can see already so many people here in the Zoom room as we actually count down to Teach to Reach Connect 4, which is going to be, I think, exceptional based on all the items that we have on the schedule already.
Great.
So, I'm connecting on my tablet.
All right. Well, I'm just glad you're able to connect. And I know, you see, we are all in the same boat when it comes to connectivity. So here we are now back to the schedule, Teach to Reach Connect. So you have at 3 p.m. Geneva, make sure we always include a little link that says check time. And if you click on that link, it's a safe link. You will actually see what time it is in your local area. So that's very important. Whenever you see blue text with underlined, that's a link. You click on that, usually gives you something that can be useful. Now, at 3 p.m. Geneva, we'll start the first of 3 networking sessions. And really we'll be discussing universal health coverage and primary healthcare, PHC, with respect to immunization, of course. So think about the work you're doing today. How close are you to achieving the goal of effective, efficient, resilient immunization services? What might you need to do differently in the future to achieve this goal? Let's turn to Emmanuel Musa and ask him. Emmanuel, a warm welcome to you. You are a leader in the scholar community and in the online communities as well. Are you there? Are you able to speak to us? How close do you think where you work, where you are we to achieving the goal of strategic priority 1?
Yeah. Hi everyone. This is Emmanuel Musa. I'm calling from Kaduna, Nigeria, and I've been an alumni of a lot of courses with the Geneva Learning Foundation, and I've immensely learned a lot from all the calls that I've been and actually been looking forward for this Teach to Reach Connect, which is coming up on the 10th, and it's actually just like Joyce Moriti had earlier on said. It's actually a session that we will equally gain from all professionals, where we share ideas, and then where you have really done well, you need to do better, and where you've not reached, you should try probably through other peer group learnings, you'll be able to get more. Now, for here in Nigeria, we are really doing well in the issue of universal coverage, but then obviously you never can say you are perfectly well, because when it comes to the issue of health sector, there are a lot of loopholes and challenges. Probably you have a good plan, then at the end, implementation becomes an issue. Now, but for us here, the universal coverage, health coverage is actually key to us here in this country. When you look at all variables that you can look at in the issue of immunization, in the issue of primary health care, the issue of data management, in the issue of X-ray and all other activities, yes, Nigeria is actually good, and that's why you find out a lot of participants and professionals who are actually enthusiastic in trying to come into the learning foundation to learn more from other peers and professionals. Yet, I'm sure that with what Folake we need to get from Folake in the Agenda 1, which is the UHF, we've had a lot of meetings with you, Reda, and Charlotte and others. When the first time we met with Dr. Folake, we had a robust meeting, and I'm sure we'll be looking forward for a very better conversations and better dialogue when it comes to issue of and the universal health coverage to come. So I'm so happy that I'll be there, and I'll try to be part of it. And I'm sure Nigeria will participate very, very well when it comes to issue of the learning foundation. Thank you, Reda.
Thanks, Emmanuel. So I have a question for you. How is networking on this issue different from what many of us know, especially with the pandemic, which is a webinar where you have 3 or 4 presenters who talk through their slides, and then maybe there's 5 or 10 minutes for question and for a question and answer session. How is Teach to Reach Connect different for you, Emmanuel?
Okay, fine. Thank you, Reda, for that important and very important question. The networking here is something that is unique and new because of the hoping, and I'm sure you can't get it anywhere. This is just the best, and I'm sure anyone who has been into networking here, he will definitely attest to the fact that, yes, this is one of the best that has actually happened to the learning in the global level. And this is where you need to reach out to so many within the shortest possible time, and you connect well, you network, and then you try to utilize the opportunity you have to be able to reach out to as many as you can within that little space of time that you've been given. And I'm sure during the last connect, I was able to connect with so many professionals, both at the global level, and I'm sure I've had a very fruitful and robust discussion with them where they were so enthusiastic to learn more about how we are doing it and how they were doing it in their country. Where after the minutes given them, we need to equally extend time frame for our discussion, because that is to tell you how important it is. And I can assure you, I've met someone who has happened to come from the global region in Emru. We had a very good discussion with him, the director, and with WHO. He really understood we had to add more minutes again, trying to discuss, try to understand what we are going through in Africa. So this is just a unique platform for every professional that I think for is a health professional trying to network. This is just the opportunity you have, and it comes in quarterly. Thank you, Reda, for bringing those initiatives. And this
Thank you very much.
I encourage a lot of others to come into.
Emmanuel Musa, leader in the scholar community, who happens to be from Nigeria. And yes, Nigeria is at the top of the list amongst the countries that will be represented on Friday, 10th of December for Teach to Reach Connect 4. Let's go back to the schedule then. This is just the first session, the first of 3 networking sessions, but at the same time, and so each participant will have to make a choice. We have something that we're doing for the first time that is different from networking. Immunization Agenda, as you know, many of you know, if you participate in the Geneva Learning Foundation's activities, is the global strategy. So it is your country's strategy for the decade about how to achieve the immunization goals, the roadmap for everyone working in immunization. And so IA 2030, Immunization Agenda 2030, has a number of working groups, and working group number 1 is about the theme which is serving as the banner for this edition of Teach to Reach Connect, that is universal health coverage and primary healthcare. Primary healthcare is about saving the lives of children and mothers. And together with Dr. Folake Olayinka, who's the chair of the IA 2030 working group on the topic, and together with Polenfo Draman, who's a scholar from Ivory Coast, the working group is organizing the first consultation on safeguarding and strengthening essential immunization and primary healthcare during COVID-19 vaccine rollout. So that's a lot of words, but really it is. We know how much is being asked of health professionals, of immunization professionals, more than ever with COVID. Can you do it all is the question we're going to be exploring. What can be done to make sure that the effort, the emphasis, the investment in COVID-19 vaccine rollout doesn't diminish the routine immunization that is protecting children and in some cases teenagers or adults from vaccine preventable diseases. So that will be an exciting discussion. There'll be a number. So this will be a panel discussion, and the purpose is very specific. The working group 1 is interested in listening to your experience. The working group 1 knows that where things happen is at the most local level, where vaccination actually happens. So whether you work at the local level or in the national planning team or somewhere in between. We need your contribution, and this working group is eager to actually spend more time listening in order to learn from your experience. So you'll have to make a choice between doing the networking or participating in the consultation, listening in, contributing to that. I want to go back to Joyce Moriti. Joyce, which will you choose? Will you join the networking or will you take part in the consultation on Friday at 3 p.m. Geneva?
I will take part in the participation.
Got it.
Because I want to learn more, to have a comprehensive understanding of SP1.
Understood. Yeah. All right. And you will be able to choose. There are 2 parallel sessions. You can either go off and network, or you can focus on the consultation. Now, we have some more people who I want to acknowledge, a few who've joined us online. Dr. Syed Amar Hussein Shah from WHO Pakistan. A warm welcome, Dr. Syed. I look forward to your participation on Friday. And let us know if you're following on YouTube, LinkedIn, Facebook, Twitter, wherever you are. Let us know which of these 2 will you join the consultation with Folake and her colleagues from WHO, from UNICEF, from Gavi, or will you do the networking to share with your peers? Nasiru Umar from Katsina State, Nigeria. Let us know, what will you do? And the same from Mutsir Abdullahi from Kano, Nigeria. And thank you all so much for joining already for this information session. Again, what we're doing today is just giving you an overview, a snapshot of what we're going to be doing on Friday. There is so much, so many opportunities, so many options. We felt we had to take a few minutes to really unravel all of the things that will be happening Friday. So now, after that first networking session and consultation, we're going to be moving to let me try to zoom in here a little bit. Let me see. All right, to networking session 2. And there, we're actually, if you participate in the consultation, as Joyce, we just heard Joyce from Kenya, actually from currently in the United States, explain to us she'll be joining the consultation. Well, Joyce, right after that, you can go and network to discuss what was the topic of the consultation. You can see here, it's the same topic. It's safeguarding and strengthening essential immunization services. Can we do both? Strengthen immunization and primary healthcare as we roll out COVID-19 vaccine. So that is what we'll be doing for that second session. Having said that, guess what? Parallel to the networking session, there is something else again. Now, in 750 scholars developed peer-reviewed case studies analyzing how to successfully challenge vaccine hesitancy in a specific situation. And so what we're doing on Friday, together with the Bill and Melinda Gates Foundation and together with a specialized qualitative research consultancy firm called Anthropologica, they'll be joining us. They've worked on developing a comprehensive analysis of the case studies that were developed by scholars. And we'll be sharing the initial results for the very first time during this session. So for those of you who developed the case studies, this is very much part of what we want to give back to you, is from your individual experience to the collective experience, what is the big picture? What are the lessons? What are the insights that we can gain from your experience? And we want to share back with you before we share it with anybody else. And so that is what will be happening. You can go to the schedule, check the time. That's at 4 p.m. Geneva. If you click here on the little calendar, you can actually download this to your disk or your device and add it to your calendar so you make sure you don't miss it. So this will be with John Vanderheide from the Bill and Melinda Gates Foundation, Juliette Bedford from Anthropologica, and François Gass, who workshopped with you as you were developing the case studies, as well as our own Charlotte Mbou. But most important, the most important participants in this session, once again, are those of you who are facing and challenging vaccine hesitancy in districts and health facilities, or trying to figure out at the national or regional or state level what you are going to do about these challenges. I'd like to ask, I know there are some of you, I believe Mary Goretti Akini, you participated, you developed a case study, if I'm not mistaken. I'm asking you to unmute, and if otherwise, I'm going to ask, let's see, let's see, Marigoretti, are you there? Are you able to speak to us? I'd like to hear what was your case study about, and will you be attending this session? Otherwise, let's go to, let's go to Dorothy. Dorothy Ojedi, are you there? Are you able to speak to us? And I'll make one last attempt. Yes. All right, Dorothy,
Hello.
lovely to hear from you. Remind us who you are, where you work, and tell us, do you remember developing this case study on vaccine hesitancy right before the vaccines came?
I'm Dorothy Logedi from Kenya. I'm working at the sub-county level, coordinating immunization activity. I can remember writing a case study on vaccine hesitancy, and my case study was concerning the HPV, which was introduced in Kenya to the 10-year-old girls. And the challenge we were having is hesitancy. There was misinformation from the parents that the vaccine we are introducing is having contraceptive. So there was very much hesitancy. But what we came out as for example, this sub-county, we came out on going to school to give health talk and talk to the parents direct. And that is how we gain trust from the parents. Over.
Thank you, Dorothy. Thank you so much. So you developed this case study, and you were one of 750 immunization staff to do so. And on Friday, we're going to be presenting the initial results of a comprehensive analysis that looked at all 750 of these case studies, and we'll be sharing with you some of the initial insights. And there's no recipe. We're not trying to pull out, the perfect recipe for what to do in the face of vaccine hesitancy. On the contrary, what you'll see on Friday, and what we hope we'll be able to have a great discussion on this at 4 p.m. Geneva, is in fact that what makes it work in the face of hesitancy is your creativity, your ability to think on your feet, because no two situations are likely to be exactly the same. And it is that capacity for change, for adaptation, for doing things in new ways, because that's how you're going to get the result of helping people understand they can protect their children, or with COVID vaccine that they can protect the most vulnerable elderly or health professionals amongst each other to support each other. So that's what we'll be doing in that session from 4 to 5 p.m. And again, you'll have to choose between joining the networking as a follow-up to the consultation discussion, or joining this dialogue on vaccine hesitancy. The choice is up to you. Over 500,000 immunization professionals have already registered, and you can still share. You can still share with your colleagues. There is no upper limit. The more participants to network with, the better. So you'll meet new people and strengthen your professional networks. Now, at 5 p.m., we'll be going to the third and final networking session of the day. And what are we going to talk about there? I wish Marta Ngoe, or another Cameroon scholar, was there to tell us, because the Cameroon team of alumni of the Geneva Learning Foundation program for immunization did something very interesting. They actually produced, developed, and administered their own survey to better understand the attitudes and behaviors of health professionals with respect to their own COVID-19 vaccination. Recently, in the launchpad of in the Ivory Coast Hackathon, we had the testimonial, very powerful, compelling testimonial of a young woman who works for the Ivory Coast Red Cross. And she said that for 3 months, she was campaigning to convince others to take COVID-19 vaccine, while she herself was personally too frightened of it. Too many unknowns, too much misinformation, too much she did not understand about the vaccine to take it herself. So it is a real problem that is not simply just kind of a reluctance to be sensible or to apply common sense. And it is important for health professionals, we believe, to discuss this issue and to support each other in understanding how significant is vaccine hesitancy amongst health professionals. And really what we'll be encouraging you to share is, was there a time, can you think of a time you did something that helped change the behavior or the attitude of even just one colleague towards acceptance of vaccination? Because we know it is so critical for health professionals to be protected from COVID-19 vaccine, especially those working in emergency care or in infectious disease care, but even for those working in immunization as well. And here is the number that I believe is frightening. This is from the World Health Organization. Only 27% of health workers in Africa have been fully vaccinated against COVID-19, which means the people, you, who are on the front lines against the pandemic, not all of you are protected, far from it. So we will be having, hopefully, it's a sensitive issue. It's very personal. It's also very politicized in some countries. But we're hoping that, again, public health will prevail and that the common sense and the dedication and the commitment and the diligence that we've seen in so many of you will be at play here, and that you'll be able to have one-to-one networking discussions. If you want to participate, especially in this one, make sure you go to the little calendar, and then you can click and download it to your device and add it to your calendar, so you make sure you don't miss that session. I'd like to ask, let me go to perhaps, let me see, Christiana Dua. Christiana, warm welcome to you. I'm asking you to unmute, and I'd like to know, will you be participating in networking session 3? Do you have things you would like to share in your experience on Friday, not right now, about the this issue of health professional COVID-19 vaccination? I'm also asking other folks, Ainau, Sarai Musa, and a couple of other people if they're able to unmute. We'll see. All right. Okay, yes, Ainau, Sarai Musa, please introduce yourself. Tell us who you are and what you do. And then tell me, are you going to participate in this networking session 3 to discuss with other health professionals this issue of COVID-19 vaccination for health professionals? All right, I can hear something. Unfortunately, I know, Sarai Musa, it looks like your connectivity is not sufficient in order. And it's too bad. If you can type in the chat, I will make sure that you can.
Can you hear me?
Just barely. I'm so sorry. And this will happen on Friday. This will happen to some of you. And despite your best efforts, some of you won't be able to fully participate in the networking. Be that as it may, we'd like you to make your best effort. Do your best to see if you can join. Now, we've almost made our way through the program for Friday. Just do you realize we have so much going on in Teach to Reach on Friday that it's taken us 31 minutes to actually just tell you about it. So we have one last event, and it may be the most important one here. Before I introduce that final Immunization Agenda event, I want to go, let me see. All right, we have, gonna go to a few people. Carolina B from Canada. Wonderful to have you with us, Carolina. I hope you'll be with us on Friday. Go to learning.foundation/teach to reach to request your invitation. Let us know if you have done that already, Carolina, and let me know if which of these sessions is the one that you're most interested in. For all those of you who are watching on Facebook, YouTube, or LinkedIn, type into the comments. We're receiving your comments. Atahir Abubakar, another leader in the scholar community, is here. And then Dr. Farhan Ali following from Djibouti. Just a few of you. We're not going to be able to acknowledge everyone because I do want to tell you about this final session. So you can see it here. And you'll see it's at 6 p.m. Geneva. So I know that's, for folks in India, that's quite late. You can join so it is a commencement ceremony. We do something called the Impact Accelerator. And on the 3rd of December, we have alumni who finished 4 weeks of collaboration focused on what? implementation of the action plans for Immunization Agenda 2030. So it's a remarkable process called the Impact Accelerator, developed by the Geneva Learning Foundation with you, with immunization professionals from all over the world. Ran for the first time in July 2019. This is a third Impact Accelerator, but it's the first one we did for IA 2030. So there'll be a commencement address, and then we'll review. You'll hear from practitioners what they have been able to achieve in the accelerator, how joining the accelerator has helped practitioners on the ground do their job, do what the Ministry of Health is asking them to do, but do it better and faster. And then, of course, we'll award certificates to successful completers to recognize the remarkable work that's been done. So during 4 weeks, participants set weekly goals. It's not a course. It's really focused on the actions, on execution. So an action plan is one thing. That's just an intent. It says, I'd like to do these things. The accelerator is where we put you to the test. You said you wanted to do these things. Let's see what happens when you try to do them. So that is what we'll be doing to close Teach to Reach Connect on Friday, the 10th of December. So let me just recap. We have Teach to Reach Connect. That's the networking event. Let me go first to Tina Michael. Tina, are you there? We'd love to hear from you. You have your
Yes, I'm
unmuted.
here. Good evening.
All right, wonderful.
Good evening.
Please introduce yourself. Tell us who you are, what you do, and what is your...
I'm Tina Michael from Kaduna State. I'm an RI supervisor.
All right.
And Kaduna, I'm in Nigeria.
All right, wonderful to meet you, Tina. Have you attended Teach to Reach Connect before?
No, I haven't.
All right, so I would like to warmly welcome you and hope that your connectivity will be as good as it seems to be right now, because you have an excellent connection. We hope you'll enjoy networking on Friday. Let me go actually to Abubakar Mohammed Garba. So he is a young doctor. He's going to introduce himself to you, Tina, and let me ask him, Abubakar, are you able to please introduce yourself and tell Tina what she should expect? Will you welcome and support her on Friday at Teach to Reach Connect 4?
Hello, good morning. Am I audible?
Yes, there seems to be a lot of background noise. Yes.
Hello, am I audible?
Yes, please go ahead.
Yes. I think your voice is breaking.
Yeah, good morning. Good afternoon, Ms. Tina. I am Mohammed Abubakar Garba. I'm also calling from Nigeria in Gombe State. During Teach to Reach Connect, you will have a discussion with global immunization professionals, with immunization experts. There is many more as far as you are expecting. So you will learn a lot about immunization and other health activities. Thank you so much.
Thank you.
And Tina, of all the things that we've laid out for you, what you heard about the program, what is of the greatest interest to you? Why are you making the effort, taking your precious time to attend on Friday?
I want to know more about the immunization schedules, and I think I want to get more educated. They say experience is the best teacher. I'd like a situation where most of the problems I'm having in my own place are probably insecurities and hard to reach places. So in this very forum, I should be able to learn how to reach them, how to be able to give more awareness to these people.
Wonderful, Tina. Thank you. I hope that you will be able to learn this and more from your colleagues, as well as share your own experience. Wonderful. Let me go to, let me see if we can hear maybe from one more person, Mary Nana Ama Adomako. Or let me try Mary Goretti again to see if there's another person who's an alum, who's been in Teach to Reach and who'd like to share with you what to warmly welcome you as well. Mary Nana Ama Adomako, please go ahead. Tell us where you're connecting from and what is your message for Tina Michael, who's going to be joining Teach to Reach Connect for the first time on Friday.
Hi, Tina and Michael. Welcome to this educative community. I'm glad you have joined. Yes, and you will not regret. It's very educative, insightful as well. And we tend to share experiences from each other. That is what Radha was talking about, different from the other webinar sessions. This one is more interactive. You get instant interaction with other colleagues across the continent, which is very helpful practically. So you know what you are sharing and learning is practical on the field. And I hope you stay and learn more with further web sessions. Thank you and welcome.
Thank you very much, Ms. Margrethe. Thank you.
Wonderful, Tina Michael. Thank you. Let's offer a round of applause for Tina and all of the other scholars who are going to be joining for the first time on Friday, as well as every one of you who is returning for more. Thank you so much, Tina. We appreciate your participation. We appreciate your commitment that you're opting in to join us. You don't have to do this, and yet here you are. We also want to acknowledge Leke Emmanuel Raphael from Niger, as well as Maman Bougaud Bakr, also from Niger. So wherever you are, you have one last thing to ask you, and you're going to see it's very simple. It'll take a few seconds, but it can make a whole lot of difference. This is networking, so the more people network, the better for everyone involved. Let me show you what I mean. When you go to the Teach to Reach page, if you have not done this yet, do this at least once. You click on the little WhatsApp icon here, and then you'll see within a few seconds, you'll get this message: send the following on WhatsApp. And what you're sending to WhatsApp is the invitation to join Teach to Reach Connect. So you click on allow, and boom, that's going to go to your WhatsApp, and you'll be able to share the invitation with your colleagues. It doesn't just cost anything, and there is no limit. So the more, the merrier. The better the quality of the experience that we will all have, the greater we are in numbers. Tina, can you think of colleagues who would like to join you on Friday, or will you be the only one from your location?
As it stands now, I think I'm the only one. My other colleagues who would have loved to join them, they are in school and they're having a little bit of difficulty connecting. But I think for now, I should be the only one connecting from my area. So whatever it is that I learn, I'm going to upgrade them and then let them know what it is and what it is about. So you don't just tell them to come and join Teach and Reach without understanding what it is about. But by the time I'm through and I think I would have gotten more experience, I should be able to invite them.
Wonderful. Thank you so much, Tina. I think that's another round of applause for Tina Michael. Greetings to Karar Shah from Pakistan. Thank you so much. I think we're going to stop here with Teach to Reach. For now, we have so many opportunities. We had to do this information session just to explain what it is we'll be doing on Friday. And I'm actually going to unmute everyone so we can make some, let's say, some real noise here and show you what the Zoom room looks like right now as we're getting ready to... All right. So please, I'm asking everyone to unmute and feel free to, let us know what you want to say goodbye.
Bye, everyone. Thank you so much for the welcoming.
Goodbye, Tina. You're welcome.
All right. Thank you. I really appreciate it. I know Musa. Thank you. To Joyce Mureti, thank you. Margrethe.
Thank you. Welcome.
Thank you.
Bye.
Bye.
Mommy, bye-bye.
Bye, everyone. Thank you. Bye.
I can hear Mommy with that song. Bye-bye, Mommy.
Bye.